Hello and welcome. If you are joining us today, that means you may be a new mom yourself or have a loved one who recently welcomed a new addition to her family, and you have questions about how all of that can be addressed during the COVID-19 pandemic. With us today is Dr. Paul. He is the chair of pediatrics here at Christiana Care. Dr. Paul, thank you so much for joining us. The COVID-19 pandemic has added so many new questions on top of questions new moms typically have. The first question so many have on their mind is, if they were COVID positive during pregnancy, could they have passed that on to their newborn?
Well, luckily, the chance of getting a COVID infection during the birthing process is considered extremely low. We don't know for sure because there's relatively little data, but what we know is that that chance is very low. We do know that after the birthing process, once a mother goes home, if she remains infected, there is a chance of passing that infection onto the newborn. However, we know that the severity of illness in babies and children in general is very low.
So how does that impact breastfeeding with new moms?
Well, we recommend that all mothers follow the American Academy of Pediatrics recommendations. And those recommendations are that mothers provide breast milk, however they use express breast milk, and give that breast milk to the baby in a bottle. We know that there is no proven transmission of the virus into breast milk. However, to be safe and avoid the close contact that is necessary when directly breastfeeding, we suggest that the mother pump the breast milk and give it to the baby in a bottle separately.
If a new mother has tested positive for COVID-19 or thinks that she is symptomatic for COVID-19, should she be in contact with her baby at all?
Well, once a mother goes home, it's best, if it's at all feasible, if at all possible, to have a healthy caregiver care for that baby. And what we recommend is the mother can go back to directly caring for that baby after she's been fever-free for 72 hours and it's been at least a week since the onset of her symptoms. We also recognize that in some cases it may not be possible for a healthy caregiver to care for that baby. In that case, mother should always be using a mask when she's directly caring for the baby, practice really careful hand hygiene, and when she's not caring for the baby, make sure the baby's at least 6 feet away.
And in a separate interview, we spoke with Dr. Hoffman about how we're caring for pregnant patients who may be COVID-19 positive, but that care does continue once the mother gives birth. So explain a little bit about how we're caring for those postpartum mothers.
Absolutely. Well, the birthing process for the mother is really not changed. We are well prepared here to care for mother and baby once that mother comes in, should she be COVID positive. And most of that has to do with protecting our staff with adequate protective equipment, protecting the baby by avoiding direct breastfeeding after birth, finding a healthy caregiver to care for that baby, and really working with mother to go over instructions about how to care for that baby at home. So we are well prepared to care for a mother who is COVID positive or may have symptoms of a COVID infection when she comes in to give birth.
And what's your main message to our viewers, some of whom may not be your direct patient, but may be a new mom just looking for more information?
Well, luckily, what we know is that although COVID is certainly a serious illness, it tends to be much less severe in both infants and children. And so it is possible for infants and children to get infected, but the symptoms are much less, the chance of needing hospitalization are much lower, the chance of needing intensive care are much lower in infants and children. And so we know that with proper protection, proper hand hygiene, social distancing, and caring for that baby as instructed, it's really a very small chance of that baby getting infected and getting into trouble.
And before we let you go, we are sitting in our brand new lobby, soon to be open in the coming days. So give our viewers a sneak peek of what they can expect with this new building.
We are really excited about the opening of the new building. It's been a lot of years of planning, and this building was really designed for mothers, for babies, and for families. So there is going to be just so much more family space than there is in our present building. We have single private room neonatal intensive care unit rooms so that every baby is with their family, and every family is with their baby in the room and not sharing a room or space like we have in our present NICU. We're also going to be able to provide couplet care. We're one of the first hospitals in the United States to do that. That couplet care involves caring for the mother in the neonatal intensive care unit so she does not have to be separated from the baby. So it's just going to be a really special place for families, the kind of space that families and patients deserve in Delaware.
That's great. Well, thank you so much for all of that information. And if you have any more questions about caring for your new baby during the COVID-19 pandemic, please leave your question in the comments wherever you are watching this video, and we will try to get back to you as soon as we can. And be on the lookout for more information about our new building in the coming days.